Okay, thank you, Marina. I welcome everyone to this webinar, and it is a real great pleasure to be on this webinar once more. We have had a series of webinars. In fact, here from South Asia, we have done a lot of work both on COVID and on pre-COVID social protection issues in South Asia with International Policy Center for Inclusive Growth. Now there have been almost five webinars before covering non-contributory social protection, um, and strengthening social contracts in South Asia in the aftermath of COVID, social expenditure, legislative framework, and finding of the impact evaluation of social protection in South Asia, social and profiles of social protection systems of Nepal, Sri Lanka, Afghanistan, and profile of pre-COVID-19 social protection system for India and Pakistan, and a snapshot of their COVID response. So there have been five webinars, and this is the sixth and perhaps the last one. I say perhaps because one can be never sure about what's coming next in this world today. So we might be on again, but this is the last of the current series of the webinars. And you can see all the recordings of all the previous webinars on a YouTube link that will be shared with all of you. Next slide. So the references of the studies that we have been giving to you webinars on essentially are on the screen right now. These studies cover social spending in South Asia, an overview of the government expenditure on health, education, and social assistance in South Asia, overview of non-contributory social protection programs in South Asia from a child equity lens, gender and social protection in South Asia, an assessment of the design of non-contributory programs. This was finished last year. Social protection legislative frameworks in South Asia from a child rights perspective. Number 5, evidence linking social protection programs in South Asia with child poverty, economic growth, and improvement in human development. And the last one that we have produced is socioeconomic impacts of COVID-19, policy response, and missing middle in South Asia. This covers the informal sector in South Asia. Next. Now we have a very nice panel of speakers today. And obviously, as you all know, these webinars we are bringing to you as a part of the regular webinar series that we have been having and will continue. The speakers today include two researchers from International Policy Center, Fabiana Basil, I hope I'm pronouncing the right last name correctly, Krista, sorry, can you go back to the previous slide? I just want to give the names of all the, Krista Alvarenga, she's also a researcher from IPC, and then McKinnon, who's our Chief of Social Policy from Bangladesh, UNICEF Country Office. And I am Abdul Aleem. You have seen me before. I'm the Regional Social Policy Advisor. I cover South Asia from UNICEF Kathmandu office. Next. So Fabiana is working with the International Policy Center for Inclusive Growth. She is working on projects related to implementation of universal child benefits in Latin America, universal basic income, and is the focal point for the agenda with India. She holds an MPhil in development studies from University of Cambridge and has a BA in economics from Federal University of Rio de Janeiro and a BA in international affairs from the Federal Fluminense University. Next. Then we have Krista Alvarenga. She's also from IPC. She is currently working on a project on social registry in Burundi, and she's a focal point for agendas with Bhutan and Maldives. She holds an MA from Graduate Institute of International Development Studies in Geneva, Switzerland, and a BA from Bucknell University in Lewisburg, Pennsylvania. Next. Yeah, sorry, I lost the connection for a minute. And then McKinnon Waldegorgis, who is Chief of Social Policy Evaluation Analytics Research at UNICEF Bangladesh. He has worked for UNICEF for over 25 years and has experience in Africa and Middle East. As a national of Ethiopia, He has received a postgraduate degree in economics from McGill University in Canada. Next. And then it's me. As you know, I'm the regional advisor for social policy. I've been working for over 20 years in many countries, including South Asia, where I've been here for over 5 years. I've covered 4 different regions of the world. And my major interest is actually in human rights-based approach to policy. Okay, next. Now, if you, while the speakers are speaking, you don't have to constrain yourself, and you can actually type questions in the Q&A box. This is as opposed to the chat box, which we'll be using for other purposes. So please see in your screens you have a box which is called Q&A box, and this box will be available for you to write your questions. You can also interact with us on Twitter on @SPGateway. With a hashtag of SP or webinar. Next. So we are today talking about pre-COVID-19 social protection profiles and crisis response. This has been a research program that we have undertaken with the IPCIG research team. It forms a part of a larger project that we started almost 2.5 years back with the IPC team. And we have done a lot of work pre-COVID. So some of these webinars, although they may sound a bit out of context because of the rapidly changing COVID situation, but they are certainly important in the sense of understanding what kind of social protection profiles countries had and what were they building on when they actually were hit with COVID. So they are particularly timely in the sense of understanding how these countries were actually placed before COVID actually hit them. Next. Okay, so now I hand over my mic to the next speaker, which is Krista. And Krista will cover Bhutan for us, and then we will move on to Maldives and then to Bangladesh. Krista, over to you. Thank you.
Let me first, good morning, everybody. Good afternoon, good evening, the 4 corners of the world. Let me share my screen here for Bhutan. I know that Dalim already alluded to the comparative studies that have been written in the past 2 years by IPCIG, but just to frame a little bit more our IPCIG presentations, the PowerPoints for today. They take information from the comparative studies, but they take the country takeaways and specifically structure them alongside 5 modules. The first one being the legal framework, then we move to social expenditure. Thereafter, talk about the social protection programs, design features, including child and gender sensitiveness of these programs. Then there's impact evaluations. And thereafter, actually, we also talk a little bit about the COVID-19 social protection responses that were taken in the countries. So moving to Bhutan specifically, when we start talking about the social protection legal framework in the country, we start with the international human rights instruments. And out of the 9, Bhutan is member to actually only 2 of them, being the Convention on Elimination of Discrimination Against Women, and the other one is the Convention on the Right of the Child. The Right of the Child Convention, they did a review in 2017 and recommended to Bhutan to actually include all the rights enshrined in the CRC in their legislation and also harmonize child rights related provisions. So these core international instruments are quite important because they help to countries to respect, protect, and fulfill the social protection instrument, the social protection rights enshrined in them. When we look at the constitution of Bhutan, social protection is defined as a policy principle, which means that they are not enforceable rights. But they do define further what social protection means. It's adequate standard of living, as well as access to basic public health services and right information. I'll talk about the two social protection programs that made it into our sample in a bit, but at this point I want to mention that neither of the two have any statutory legal coverage related to them. Moving on now to the social expenditure. So in our studies, we included health education and social assistance. And when you look at the column that's in the graph that's indicated by the big green arrow, you see Bhutan and you see the three different expenditures, health education and social assistance. You can see that Bhutan spends about 10% or allocates about 10% of its GDP to social expenditure. Taking apart these, not the numbers necessarily, but the government on health actually covers about 70% of the all the financial costs for people, and about 20% of the costs come out of pocket, which is very good for the country. However, some of the indicators are actually still lagging behind. For example, we take births attended by skilled professionals. The overall country indicator says that about 90% of all births are attended by skilled professional. However, there is quite inequality of health service coverage, meaning that when we take this number apart, we see that about 100% of the births are attended by a skilled professional for the wealthier part of the society, while as this number is only about 40% proportionally for the poorer quintiles of the society. So high inequality of health services coverage. When we're moving to educational spending, the country spends about 20% of its government budget on education. However, there are also little issues there, because about only 67% of the adult population is literate, and there quite a high proportion of school children are out of school, especially for primary levels. With regard to social assistance, when you look at that 0.3% of the GDP that's spent on social assistance, most of it goes to the school feeding program in the country. So that indicates that there is actually quite a lot of space for other social assistance programs in the country. Talking about the fiscal space for social protection in the country, Bhutan is planning a goods and services tax reform, which hopefully will also contribute to expanding the tax base for social protection. Now, moving on to the two national non-contributory flagship programs that made it into our sample. It's important to highlight here that only national non-contributory programs are in our sample, and no subnational programs were included. The two programs that are highlighted for Bhutan are in the first column here on the programs, and but you can see that there's a third one. The third one is indicated with yellow. This is actually a COVID-19 kind of a national non-contributory program, and it's added there because it has quite a prominence in the country. I'll talk about it in a bit. So with regard to the typology of the programs and the other mechanisms that are indicated here, when we take the first one, which is the Rural Economic Advancement Program, it is actually a sustainable livelihood program that has two components. One of them is unconditional in-kind transfer, where they transfer agriculture and machinery to the people, as well as provide some access to food and the nutrition. And the other component is housing improvements and some training. They use a geographical targeting method or mechanism for this program, meaning that the most poverty prevalent regions of the country are chosen to be targeted, and all the families or all the households within that region actually receive the benefit of the program. Moving on to the school feeding program, which is the second one, the typology, I mean, it's quite evident from the name of it is that it is a school feeding program. It uses categorical targeting mechanism, meaning that you have to be a student in order to be a beneficiary of this program. But they have further, they specify further eligibility by giving priority to the students that live furthest away from school. And this is done by the school board. With regard to the benefit type, it's interesting because the government doesn't only send non-perishable foods to the schools to be used, but they also give a little cash transfer per child that's covered under the program. And from that cash, the school buys actually the perishable foods. Now jumping to the program that's highlighted in yellow, this is now a COVID-19 social protection response in the country. It's called the Truk Gyalpus Relief Kiro. It's an unconditional cash transfer, and it targets mostly the working age group people and categorically. So the people that have lost their job have been put on non-pay leave, but it also includes Bhutanese that are returning back from overseas and do not have an income, but you have to, yes, your job must have been affected by the COVID-19, and it's a cash transfer that people receive. I'll talk a little bit more about it in the end. Now, moving to the coverage, again, these are pre-COVID numbers here. Just to give a little bit of an idea what the coverage of the national non-contributive flagship programs in the country is, that when you look at the little pie chart that I have here, this indicates the school feeding program that covers about 75,000 students, which is about close to half of all of the school age children. And the REAP, the Rural Economic Advancement Program, for the latest year that we had information for, covered 536 households, which is about 1% of the coverage. Now, talking about the child and the gender sensitiveness of flagship social protection programs, again, in the first column, I have highlighted the three programs. When we look at the school feeding program, so it helps with, it prioritizes or responds to children's needs such as education and health and nutrition. The Rural Economic Advancement Program, on the other hand, is not responsive to any of child-specific needs. And the Truk Gyalpus Relief Kiro is child-sensitive because the partial amount that some of the adults can receive, if you have a child in your household or more children in the household, there is a 800 ngultrum, Bhutanese ngultrum, that's paid to you per child per month as well, together with the COVID cash transfer. When we look at the gender sensitiveness of the flagship social protection programs, we see that there are no tick marks or no crosses in the table. That means that none of the programs, including the COVID program, didn't target or prioritize women. However, it's important to highlight at this point that the country is planning to launch a conditional cash transfer yet in 2020, and maybe it's a little delayed because of COVID, but it's called Accelerating Mother and Child Health Outcomes. And it is to boost the maternal, neonatal, and child health through monetary incentives, meaning that the pregnant women are eligible for the program in case that they are not covered by any other paid maternity leave for at least 6 months. And so the money, the cash transfer, is directly sent to the mother's bank account up to the age of 24 months of the child. So soon we'll probably have a little bit more crosses in this table for gender and children. As said, I'll talk a little bit more about the COVID-19 crisis responses. Two of them are highlighted here. The first one is the relief kiro that I talked about a little bit. It's a social assistance measure. And by, I think, July, when we finished writing this paper, we had, the program had reached about 23,000 people, including children. The eligibility criteria had to do with people being laid off or being put on the reduced pay, as I talked about before. And then they had two different, or they have two different levels of pay transfer that the adults can receive, 12,000 or 8,000 Goldrum. And there's also the child-specific benefit that children, the adults with children can receive. The other social protection COVID-related response from the country is related to adaptation to the school feeding program. So not the 75,000 students that usually are covered by the program were reached, but about 10,000 most vulnerable students were chosen, and they were provided with the take-home rations of different kinds of foods to the value of about 900 Bhutanese Nupultrum. So ensuing from what I've said and what comes from the different studies, we would recommend that Bhutan increases its social assistance programs, including also adequately identifying beneficiaries and their needs. Also, with regard to the funds of the COVID-19 to the relief, we recommend that maybe these funds could be turned into lasting social protection programs. It's obvious that the country could target and prioritize women more, also including unmarried women. So within the Sustainable Livelihood Program, and as well as in the training programs that are there. And also benefit children. So the most vulnerable and the age when the outcomes for life can be quite big. So 0 to 6 years of age, preschool age. We talked about the already upcoming programs. So Precipitate actually rolling out this program. And last but least, not least, last recommendation is rolling out the legal and regulatory framework for the flagship social protection programs, as well as have them adhere to the human rights-based approach principles. That concludes my presentation for Bhutan. Thank you very much for listening, and looking forward to any and all questions. Thank you.
Well, that's really great. Krista, you finished a couple of minutes earlier. We have already seen a couple of questions come in, so great. We'll return to a specific question to you when we come back for the question answer session. But let me hand over to Fabiana. Please, Fabiana, go ahead and make your presentation.
Thank you, Alim. Thank you, Krista. Let me just share my screen here. So as Alim has said, my name is Fabiana. I'm a researcher at IPCIG, and I'm the focal point for the agendas with Bangladesh and India. And today I'm going to present the results from the studies regarding Bangladesh. So starting with social protection legal framework, the table is showing that Bangladesh is a state party of 8 out of the 9 core human rights instruments related to social protection and children's rights. But this doesn't mean that all of them are fully implemented in the country. For that to happen, these instruments must be translated into domestic law, which is not always the case, as is exemplified by the Convention on the Rights of the Child. So even though Bangladesh is a state party and has enacted the Children's Act in 2013, there are still several important legislation missing to ensure that everything that's contained in the CRC is reflected in the national legislation. And this was actually the recommendation made by the CRC committee in 2015, that this legislation still needed to be enacted. Social protection does appear in the constitution of the country, but it's not an enforceable right. It's a policy principle, so it's something to guide the policies. And regarding the statutory legislation that refers to the social protection sector, there are 2 main ones. The first one is the Voluntary Social Welfare Agencies Law, and the second one is the Foreign Donations Act from 2016. The second one is the one that provides the legal basis for the only for the only program in our sample that has a legal basis. Considering that we have 11 programs on it, it's a very low number still. Now moving into social expenditure. As you can see in the graph, Bangladesh has a low level of government expenditure considering the rest of the region, but the outcomes achieved by it are overall positive. But of course, that this low level does come at a price. This is easy to see if you focus on the healthcare sector in particular, because the situation means that the level of out-of-pocket expenditure is quite high. So families are responsible for paying for at least around 70% of total healthcare expenditures. As a result of that, 4.5% of the population has fallen below the poverty line of $190 per day because of health-related spending. So one thing that would be important for the country to do is to increase the social expenditure. And one path that could be used to achieve that would be to increase tax revenues. Of course, this is not an easy political negotiation, but the country does appear to have some room for that because it is a fast-growing economy and the level of tax revenue is still low. So it could be a possible path in this case. Now, focusing specifically on the programs that are in our sample, this table is basically summarizing the main information. Here, I just want to give a very quick explanation. You can see that we have a letter E appearing. This means that it is an eligibility criteria, while the letter P indicates that is a priority criteria. So people don't have to have these characteristics to be eligible. I'm not going to have time to talk about each of the programs because we have quite a few and our time is limited, but I'm just going to give the main characteristics. So as I've said, we have 11 national flagship programs in the sample. We are not, even though they're quite important, in Bangladesh, we have not included subnational programs because they're not in the scope of the study. As you could see in the table, the programs are quite varied. So we have in-kind transfers, we have cash transfers, both conditional and unconditional, and many of them are linked to education. Besides that, some of the programs have multiple components. So for instance, the maternity allowance for poor lactating mothers, which to be fair, it's actually 2 programs, but they're very similar. So we have considered them as one. But besides the cash transfer component, it also comprehends in some areas social care services and professional training. And besides that, we have the case of the public food distribution system. That's an umbrella intervention with 10 different subcomponents. And these subcomponents, they vary in terms of their purpose, type of benefit, level of benefit, and targeted population. Regarding targeting mechanisms, most of these programs in the sample employ at least 2, some of them employ more. The 2 more popular are means testing and categorical targeting. And the programs that also include a component of school fee waiver also employ school committees to mediate the eligibility to them. Now, focusing on child and gender sensitiveness, you can see in the table that there are quite a few programs that have these components. And then focusing on gender, there are some that have clear gender objectives, such as the employment generation program for the poorest that include a quota of at least 33% for women. And we also have programs that include gender-related criteria among their prioritized groups. So this is the case, for instance, of the Old Age Allowance program that prioritizes widows and single female-headed households. So this table is summarizing the results of other studies that made impact evaluations of the programs that are included in our sample. You can see that 4 out of the 11 studies have been evaluated. Again, I'm just going to give a very brief explanation on the table. So the dark green color indicates that positive and desirable outcomes are statistically significant. The lighter green means the same, but this is true for only a subgroup of the population. This beige or nude color indicates that no statistically significant effects were found, while this orange color indicates that undesirable effects were found. So overall, you can see that all of the programs that have been evaluated have been found to have positive impacts. Now, focusing on the response of the social protection system to the COVID-19 crisis. Before I talk about it, I just want to give a warning somewhat. We had a little bit of a hard time to have information on what was actually implemented. So what I'm going to say refers more to what was announced. So the implementation could be a little bit different. But the social protection system was expanded to provide for the support during the crisis. And this response included both social assistance and social insurance and labor market policies. I'm going to focus a bit more on social assistance, but the expansion of the social assistance system was through both adaptations and expansions of pre-existing programs, as is the case of the food transfers or food subsidies, but also through the implementation of some emergency and temporary benefits, such as the emergency cash transfer that was supposed to benefit 5 million vulnerable families. But this response was also marked by several corruption complaints. And actually some of these interventions had to be interrupted and then started again to deal with that. But what the government did was to create a database uniting the beneficiaries of several of these benefits, especially the food benefits, and some vulnerable families as well that were appointed by local governments. But so based on this database, the beneficiaries would receive a QR code, and this QR code would be used to mediate the access to these responses. And this is something that would be implemented not only during the COVID crisis, but would actually continue afterwards. Now moving to the last part of the presentation, the policy recommendations. So the first one is to improve the legal coverage of programs. As I've said, only 1 out of 11 has a legal basis. So it's important to increase that, making sure that the legislation complies with the human rights-based approach to social protection. Besides that, it's important to increase the level of spending on social protection. This is particularly important if you think about the healthcare sector, because as I've said, it represents a heavy burden for vulnerable households. And as we're still in the middle of a pandemic and the effects of this pandemic, the medium and longer term effects on the health of people that have been infected by the virus are still largely unknown. It's important to deal with that, to make sure that this burden doesn't become even heavier in the medium and longer run. And there are a few paths that could be used to expand this social protection expenditure. So one thing would be to explore tax revenues, but you could also further rationalize the investments of existing programs. This would allow an expansion in the social protection system because this pandemic has also highlighted several limitations that the system has, especially regarding some populational groups that are not reached by this current system. On that, the first group to be highlighted are the missing children. They are neither covered by newborn benefits nor school benefits. We also have the missing middle. There are the informal workers that represent a considerable share of the labor force in Bangladesh. These informal workers are not usually reached by traditional social insurance instruments because they're not part of the formal sector, but they're often above the income threshold of social assistance programs, so they're also not reached by social assistance programs. And in the case of Bangladesh, another thing that's also important is to make sure that the expansion of social protection is following the urbanization process, because Bangladesh is a fast-growing economy. It is going through a fast process of urbanization, and social protection coverage is still mainly focused on rural areas. So urban populations have to be better covered. And lastly, the adaptation in the designs of some of the programs that are in place could also enhance the outcomes of them. The first thing would be to link cash transfers, especially those that are directed towards children and adolescents. So link these cash transfers to other services, basically turning them into cash plus interventions. And also, it would be important to make sure that the conditionalities of some of these transfers are not controversial. This is particularly the case of the secondary education stipend program that requires the beneficiaries to remain unmarried and not have children while they're secondary students. But even though these are desirable outcomes, there are other ways to achieve them that would not affect the beneficiary's agency and self-esteem. So you could look into, for instance, in increasing the participation of the beneficiaries into peer-to-peer groups. This was all. Thank you all for the attention. And please, if you have any questions, feel free to ask in the Q&A box. Sorry.
Okay, Fabiana, are you finished?
Yes, I'm trying. Yes, thank you.
Okay, excellent. So I believe we have questions coming in. We will wait for the last presentation to finish, and then we'll move on to the question answers. Mekanan, you're next. Thank you.
Thank you very much, Alain. for the introduction already. My name is Makonnen. I'm Chief of Social Policy, Evaluation Research and Analytics at UNICEF Bangladesh. Let me share my screen. I hope you can see the screen now. Ali, you can see the screen. Okay, so
yes, you can.
My presentation is about a recent study which was conducted in collaboration with UNICEF, the Planning Commission and Development Pathways. I'll talk about the objectives of this study and the methods and approaches used and the findings, particularly on macro and distributional impacts of COVID-19 and recommended social security stimulus package based on these findings. The objectives of the study, it aimed to assess the impact of COVID-19 on the economy, household income, consumption, poverty, inequality, and social protection response to mitigate the fallout by the most vulnerable segments of the society, particularly children and their families. It is meant basically to inform the UN immediate socioeconomic recovery framework and the ACE 5-year plan of government of Bangladesh. So the modeling approach used basically is based on the Bangladesh social accounting matrix, which is calibrated to 2020, and which is aligned to the sector classification used for the ACE 5-year plan and household classification with age cohorts. It used computable equilibrium model and microsimulation modeling using the household income and expenditure survey of 2016. The economic scenario was built for CG modeling, included 3 scenarios. The first being the scenario without COVID-19, which is a pre-COVID-19 scenario, a low impact scenario, and high impact scenario. The without COVID-19 scenario assumed that the economy in 2020 performance in line with pre-COVID projections are set out in the macroeconomic framework for the ACE 5-year plan in February 2020. In this scenario, annual growth rate of more than 8% was projected, assumed. The low impact scenario aligned with the government's revised macroeconomic framework for the ACE 5-year plan as revised in May 2020, and it also took into account the anticipated macro effects of COVID-19. The high impact scenario used a set of assumptions that are more pessimistic than those in the low impact scenario, as we see them in the next slide. Okay, so the assumptions shows there are 4 transmission channels that are considered. The first being the garment industry. As many of you are aware, the ready-made garment industry contributes about 85% of Bangladesh export. So in the low impact scenario, the 10% reduction in annualized export demand is assumed, while in the high impact scenario, an annualized reduction of 30% in export demand is assumed. For foreign remittances, foreign remittance also play a significant role in Bangladesh economy, contributing about 5% of GDP. And in the low impact scenario, 3.7% reduction is assumed, while in the high impact scenario, foreign remittances reduction by 18% is assumed. Industry and services sector, the transmission mechanism through underutilization of installed capacity because of lockdown in the low impact scenario, 5.3% underutilization for a duration of 4-week lockdown is assumed, while for the high impact scenario, the underutilization rate of installed capacity of 10.6% due to an 8-week lockdown is assumed. Agriculture sector was relatively assumed to have a little less impact less impacted by COVID-19, with low impact scenario at 3.2% growth, thanks to bumper harvest, rice harvest, and the limited effects on rural economy, while for high impact, the annual growth rate of 1.1% due to drop in demand of fisheries and livestock outputs. This is the assumptions and the shocks underlying the modeling. So based on this, the CGE model indicates that Bangladesh may experience its first recession since 1975 because of COVID. As previously mentioned by Fabiana in her presentation, Bangladesh was considered as one of fast-growing economy in this region. Without COVID, the annual growth rate, it enjoyed an annual growth rate of 8.2%. But because of COVID, economy to take a heavy hit due to demand and supply side shock, and it's expected to, in the high impact scenario, to contract by 3.4%, while in the low impact scenario, 4% growth is modeled. So, so the most likely scenario of contraction is anticipated as we stand now. In terms of impact on unemployment, unemployment rate will rise sharply as 5.2 million people lose their livelihoods in the high impact scenario. Before COVID-19, the annual unemployment rate was at 3.7%. That now, because of COVID, national unemployment rate 3 times higher than what it would have been without COVID-19 is modeled. Number of people, in terms of number of people, like I said, it is 5.2 million people losing their employment. Particularly those in the service industry affected the highest, with 2.6 million losing their jobs. In the industry, 1.7 million people losing their jobs, and in agriculture, 900,000 people losing their jobs. Children and young people are among the hardest hit by income losses. Loss of livelihoods and reduction in income will force many families to adopt potentially damaging coping strategies. As can be seen in the graph, the heaviest hit are households with children under 5 and youth population. So while the older person will experience somehow lower reduction in income, although there are still significant, especially considering that they are among the most at risk to the virus. In terms of geographic impact of COVID-19, the effects would be felt across all regions of the country almost uniformly, with a slight increase, with a slightly higher impact on the central region, which is Dhaka, the capital. Unfortunately, COVID-19 is undoing years of progress in reducing poverty. Before COVID-19, Bangladesh was doing super, well, with poverty reduction headcount of under 20% at 18.9%. As a result of COVID-19, the national poverty rate is set to rise to 34.3%, which is like 15.4 percentage point increase. The impact is particularly felt in the households with children under 5. So overall, 41% of children under 15 years are probably living below the national poverty line after the crisis. So this is one of the findings of this simulation exercise in terms of the impact on of COVID-19 on poverty. Having looked at the impact at macro and household level, the impact of COVID-19. So what can be done in terms of reversing the impact on the economy as well as on the households, especially with regard to improving the social protection system in the country, which suffers with highly targeting errors, serious targeting errors, particularly exclusion error of over 71% and inclusion error of about 45%. What you can see here is just using old age allowance as an example, which has an exclusion error of 59%, inclusion error of 59%. So this shows that how targeting is very ineffective in terms of reaching out to the neediest segment of the population. So what is the current government emergency response for COVID-19? I think Fabiana already touched on this. There are at least three aspects in terms of government response to COVID-19. So social protection response, there is primary school stipends topping up by Bangladesh Taka 25 or Bangladesh Taka 50, one-off payment of 1,000 Taka to all recipients to cover cost of uniforms, and one-off payment to poor households of Bangladesh Taka 2,500, which is less than $30, will be paid to 5 million poor households, and expansion of existing scheme like the old age allowance, allowance for the widowed, deserted, and destitute women, and allowance for financially insolvent disabled will be expanded to 1.1 million new recipients in total, and kind of universal coverage in geographically targeted 100 upazilas in the country, which is like 20% of upazilas in Bangladesh, where upazila represents the sub-district level governance structure. So all in all, while this is a good step toward this addressing the impact of COVID-19 on the poor households, however, this is only 0.13% of GDP, so it's not that big. So the value of the current emergency transfer are low, and one-off payments will not be enough to help families recover. Overall, as this graph shows, in terms of percentage of monthly household expenditure covered by these schemes, which is less than 5% for different allowances, including allowance to financially disabled at 3.35% of monthly household expenditure, like direct transfer to poor to old age allowance of like 2.4% of monthly household expenditure. So this shows how small the responses in terms of social protection to the needy households. Okay. The current response is a promising start, but it is not large enough to meet the scale of the crisis. The current response covers only few households, as we have already seen. If the one-off payments reach 5 million households, this is only 12.5% of total households in Bangladesh, which is very small. The small one-off payment to recipients of the primary school stipend will reach only 29% of all households. And as I already said, the other transfer for older people, people with disabilities, and widows also have low coverage and are restricted to only 100 upazilas, or just 20% of total upazilas in the country. A much larger stimulus package will therefore should therefore be introduced if families and the broader economy are to recover. So the global community, including the Bretton Woods institutions, IMF and World Bank, are now kind of looking into universal transfers, as well as the United Nations. So there is a global push, especially to meet the SDG agenda, adopting human rights instruments, and particularly the SDG principle of leaving no one behind will call for universal social protection. So in Bangladesh as well, there is this push for universal social protection, particularly using COVID-19 as an opportunity to push this agenda of universal social protection. So there is a rationale behind the stimulus package, not only for social protection, but also to mitigate the effects on the economy as a whole. So with the life cycle package, an annual economic growth would be 39 to 46% higher than it would be without it. First, in terms of bringing back the economy on track, the stimulus package of at least 2% of the GDP is recommended as part of this study. So with this package, stimulus package, the economy will contract less by 1.8% in the high impact scenario, and maybe a growth of 5.6% in the in the absence of no intervention. So in the low impact scenario, sorry. So options for expanding the social protection now that with this stimulus package, if government takes it, there are two options, especially when we use existing schemes, either through vertical expansion, which is meant to increase the value of transfers, and horizontal expansion, expanding the number of recipients and also introducing new schemes. So one major area of concern for government is that while we advocate for universal social protection, especially to address the issue of exclusion errors, massive exclusion errors, the government, they understand, particularly the Ministry of Finance and the Ministry of Planning, they understand that the poverty targeting has a problem. It failed the poor. So they are in agreement as far as adopting universal social protection to address the issue of exclusion errors, and to also be in line with the SDG principle of leaving no one behind. So the major issue that they always raise is about the fiscal space, affordability. So where do we get the money? So there are certain options that we have that are proposed as part of this study. Including quantitative easing, reallocating government spending from inefficient areas, eliminating fuel subsidy and higher income taxes on the rich, one-off wealth tax or permanent increase on the tax on property ownership, a short-term debt moratorium. So these are, and also examining the potential for taking on new loans. So these are some of the areas that we are proposing to government to consider to fund a stimulus package, which is not easy, obviously, especially for a country with low tax to GDP ratio, as already described in Fabiana's presentation, which is under 8% at the moment. So that is my presentation, and thank you very much for the opportunity. And I'll be very happy to answer questions. Thank you, Aline.
Great, thank you so much to all the three speakers who were well within their time, and thank you so much for listening to all our participants. I believe we have about 11 questions. And I will try and see how we can gather them together, but I believe it's probably easier for us to start with Bangladesh, who, there's another one, okay. Sorry, yeah, Krista, please go ahead on Maldives. Sorry, I missed that, thank you.
Let me share my screen here with the Maldives presentation. Should come up in a second. So hi everybody again. Yeah, it can be confusing. I have two presentations, which is not very common. Let me put on my Maldives hat now. So with regard to the social protection legal framework, it's quite exciting for Maldives actually, that out of the 9 core human rights instruments, Maldives is a member to 7 of them. And the only 2 that are missing are the one on protection of right of all migrants, and the other one is the protection of persons against enforced disappearance. Also very exciting on the constitutional level of Maldives, social protection is actually deemed as an enforceable right for children, youth, elderly, and the disadvantaged persons. So these people, actually, these individuals can claim their rights in the courts. The Constitution also defines social protection, the economic and social rights of people, but it explicitly refers to progressive realization of these rights, and also limits it, saying that it should be within the limits of state capacity and resources. Moving to the legal grounding of the flagship non-contributor social protection programs that we chose for that made it into a sample for Maldives. Again, exciting news is that all of the 7 that are in our sample have legal grounding, so 100%. But the more exciting news yet on the legal framework for Maldives is that out of the 7 that are in our sample, 5 of them also have regulatory frameworks associated with them. So when you look at my pie chart here again, the blue indicates the out of the 7 that 5 or 71% have regulatory frameworks, and 2, which is not specifically mentioned, but have only legal coverage. Now, when we talk about the laws and acts that discipline social protection in the country, there are 2 main ones, one of them being the National Social Health Insurance Act, and the other one is the National Social Protection Act. And the National Social Protection Act regulates actually 3 of the programs, them being the food subsidy program, foster parent allowance, and the single parent allowance. Another very exciting legal development in the country is that in 2019, the country actually enacted a Child Rights Protection Act, which in it enacts legislation that systematizes child rights and specifically enshrines rights such as right to registration, to identification, to nationality, which are all pre-considerations basically for receiving social protection. So these are the exciting news of law. Now, as I mentioned, out of the 7 that are in our sample of the non-contributor flagship programs, 5 of them have regulatory frameworks, which allowed us to do the analysis of them being in accordance with the human rights-based approaches. So when you look at this little graph over here, and when we start from the very left over here, I have the programs with acronyms highlighted. The OABP, which is the old age basic pension. The HA is universal health insurance. FSUB is food subsidy program. SPO is the single parent allowance, and the FPO is the foster parent allowance. So these are the 5 social protection programs, national ones, that have regulatory frameworks. And on the bottom there are the human rights-based approaches principles highlighted. And when you look at columns 1, 3, and 5, you can see that actually the regulatory frameworks do quite well in terms of setting precise eligibility requirements, also defining the roles and responsibilities of the different institutions involved, as well as ensuring the predictability of the benefits, which is very good. However, they have some ways to go still with regards to transparency, access to information, also establishing complaint and appeal mechanisms, as well as they do not have a participatory channels within them. So there's some work to be done. Moving on to the social expenditure study. So the high column there marked with the arrow again is Maldives, shows the expenditure stacked up with regard to GDP for health, education and social assistance. And so the country allocates about 15% of its GDP to social expenditure. It's interesting to point out that about 73% of all health-related expenditure is covered by the government, and only about 19%, you cannot read this from the graph, but only about 19% of it comes out of pocket, which for Maldives is very important. It's a country with about 200 little islands dispersed, and to get to the hospitals, the transport, having access can be quite expensive. So this is very welcomed, I'm sure, by the people. And the indicators, health indicators are also quite good. When one of them is highlighted here, which is the life expectancy at birth, which is a whopping 78 years of age. Education expenditure, they have actually attained already close to universal basic education for primary and low secondary education. It's very good. And with regard to social assistance, so this 1.1% of the GDP marked with yellow on top there, most of it goes to the old age basic pension. It's also a non-contributory program. With regard to the social, to the fiscal space for social expenditure, about 20% of GDP comes from tax revenue. However, taxes are quite regressive, meaning that the direct taxation, income tax and tax on companies is quite low, and mostly taxes come from goods and services, meaning that they're weighing quite heavily on the lower and middle income households. Now, with regard to the national non-contributive flagship programs, as I also tried to very specifically highlight that we did not include the subnational programs, and they're all non-contributory. And as I said before, for Maldives, we were able to include in our sample 7 programs, and all of the programs are highlighted here in the first column. Starting with the disability allowance program. So it is for, it is a unconditional cash transfer, meaning that people with disability to receive a cash transfer, but it is also a unconditional in-kind transfer, which is at UIKT, and the type of program, meaning that the people with disability receive medical devices, and there's also social services involved. They also receive a psychological counseling when needed. I will jump the food subsidy program. It's quite a small program in the country. The name of it says that it's food subsidy. With regard to the foster parent allowance, which is the third row in the programs, and also I'd like to highlight together with it the single parent allowance, which is the very last program in the column. Both of them are conditional cash transfers, and they are conditioned on the families sending their children to school. They use both targeting mechanism as categorical mechanism and means testing. So it has to be poor households to receive the cash transfer. But interestingly, the target group for example, the foster parent allowance, which is the third one, third row, it doesn't only go to the foster parent, the cash itself, but part of it also is given to the orphan or the child. Let me also highlight the Husnova Sanda, which is the fourth one, and the medical welfare programs, both of them. So Husnova Sanda is the universal non-contributory health insurance that's available to all Maldivian nationals, and the medical welfare provides further procedures to poor households. And the old age pension, which is last year, not last in the row, but last as the program. It's a non-contributory basic pension that is given to the group of people, elderly, that have attained a certain age already. So that was with regard to the programs. Now, with regard to the coverage of Maldivian national flagship programs, these are pre-COVID numbers. It's important to highlight here. You can see in the blue, darker blue than the light blue, and 90% of the universal health insurance coverage comes from the 90% of the coverage for the programs comes from the universal health insurance. And just to give you an idea of the small size of the population of Maldives, when we look at the SPA, which is the single parent allowance, about 1% of the coverage in our programs is mapped by them, and that program itself reaches about 5,000 children. With regard to the child and gender sensitiveness of flagship social protection programs, so again, in the first column, I have highlighted the 7 programs that were included in our sample. And it's, as I mentioned before, the foster parent allowance and the single parent allowance both are conditioned on the children going to school. So these programs actually are responsive to that child, are responsive to that specific child need or need. And the Husnova Sanda medical welfare, they help with the need of healthcare for children. And also the foster parent and single parent allowance, the allowance number grows as there are more people, more children in the household. There, when you look at the last 2 columns that indicate the gender sensitiveness, there are again no cross marks there, meaning that none of the 7 programs actually target or even prioritize the female gender. Yet it is important to maybe highlight that even if there are no priorities or targets to women specifically, actually one of the SDG 3 targets, SDG 3.1, was achieved by 2015. Which is gender related, as the target that was reached was less than 70 deaths per 100,000 live births by 2015. So might be related to the Husnova Sanda and the medical welfare specifically. Now, with regard to social protection responses to COVID-19 crisis, there are several initiatives that were taken by the country. With regard to social assistance, maybe the utility subsidy should be or could be pointed out. The subsidy was provided on electricity and water bill. But the more exciting one probably is the social insurance, as the country created the income support allowance of about 5,000 Maldivian rupiah, which is a wage subsidy, and it is available for individuals that have been laid off or forced to take no pay leave or taken salary deductions. It's also available for the self-employed people, but you have to be a Maldivian national in order to receive it. Yet another exciting part of that social insurance is that actually the country is now planning on creating an unemployment insurance program. So we are yet to see what they will do with that. And also with regard to labor market policies, they had 2 different loan schemes for companies and self-employed, but part of that loan had to cover operational costs such as salaries. Ensuing from the presentation, policy recommendations would be good for Maldives to target women, priorities and target women. The second one is that it would be very nice if a country could actually launch a flagship program that explicitly targets early childhood. So 0 to 8, or 0 to 6 would be very good. When we looked at the child and gender sensitiveness of the programs, there's another important indicator, which is nutritional responsiveness. This is one of the children's specific needs. And in Maldives, we did not find a school feeding program. So if appropriate, would be good if Maldives could launch actually a school feeding program. This will help with the school, staying in school, and with learning outcomes as well. I will jump one, but the last one I'd like to highlight is that Maldives could, if possible include migrant workers in social protection schemes, because about 1/4 of the working population is from outside of the country, migrant workers, and none of the pre-COVID, neither the COVID programs really benefit the migrant workers. So thank you very much for listening to me. Looking forward to the questions.
Thank you so much. Excellent round of presentations. I'm very thankful to all the presenters who actually did it well in time. We have quite a few questions actually now on the Q&A chat. I will try to find out if we have enough time, but we will try and cover as many as possible. I will ask each of the presenters to be short in their answers, because that way we'll be able to do both rounds in about 15 minutes. I think we have 15 minutes. So the first round, we have 2 questions for Krista, and then I will go to Fabiana. Krista from Beatrice, do you have more information on the goods and services tax reform? This is on Bhutan. Are they planning to focus more on consumption tax rather than income tax? And how regressive is the tax system in Bhutan? And then the second question to Krista is concerning the recommendations, convert some of the funds of COVID-19 Kidu relief response into lasting programs. Would you recommend allocating it to expanding existing programs or to create new ones, targeted or to social groups left out? Which option could be more efficient? So Krista, you can go ahead.
Thank you, Beatrice and Isabella, for this question. So with regard to Beatrice's question on the regressiveness and the tax reform, so Bhutan, they actually had 2 tax reforms or 2 tax bills. One of them was the income tax bill, and the other one was the goods and services tax bill in 2020. And the goods and services tax, basically it converted into a flat rate of 7%, different indirect taxes such as a sales tax and customs duty and excise duty. What was happening in the country is that sometimes the goods and services were taxed double or triple. And so now this tax will be applied at the point of consumption. And it should actually reduce the price of goods for the consumer. So in a sense, it will reduce the prices for all. So it doesn't take care of the regressiveness of these kinds of taxes, but it takes care of the issue of arbitrariness at least. And with regard to the income tax bill, so they did define different slabs of income and increased taxes on more higher earning people. But overall, the income tax is quite low in the country. I think the IMF report that we used for this papers indicated that it's about only 0.5% of the GDP, which is actually quite low. So there is some ways to go. So in a sense, I would say it's regressive, but I don't have the exact numbers. With regard to the question of Isabella on Bhutan and converting the funds of COVID-19 Kidu relief response into lasting programs. So I would, as I mentioned, there is about 75,000 students that receive the school feeding program, but that's about half of them only. And so the other half of the school-aged children could also be included in the school feeding program, as it is good for everybody, for learning outcomes and for school, staying in school. So that would be number one. And the other one would be, since already the new program that's coming up, the child and health outcomes, it should be launched. So, and since there is a lot of deliberation that has been done already about this law and this program, so I would recommend that actually, if need to be, that the money is converted or put into these programs. So I hope that answers your questions.
So the next question is to Fabiana from Nicolo, referring to a study. There seems to be a program which shows limited or no impact on desirable outcomes. Could you please elaborate on the findings from this study? That's one. And then Ruby Khan to Fabiana is asking, and perhaps McKinnon can jump in, because this is about what is happening with the Bangladesh National Social Security Strategy reform process. Has the government committed to consolidating the programs into more simplified field programs that expand their coverage? What are they doing about the issues of corruption, which is a major barrier for many poor and vulnerable peoples to access social protection? Over to Fabiana, and then McKinnon, if you feel like answering the second one, please do jump in after Fabiana has spoken. Over.
Thank you for the questions. So regarding the negative outcomes that were perceived in educational programs, there were two programs that had included some statistical significant negative undesirable effects. The first one is a primary education stipend project. Program or project. No, I'm not sure. But a study found that the program's impact on grade progression was negative. In particular, oh, sorry, I forgot to start my video. But in particular for boys, so this negative impact was particularly strong for boys and girls. And there are two hypotheses to explain why you had this gender inequality there. They're both related somewhat to the lack of incentives to boys in education in this case. This is because at the time of the study, boys were not eligible to receive stipends for secondary education. So there could be a lack of incentive there to continue education. And also there were more opportunities of rural employment for teenage boys and not so many for girls. So again, there could be a matter of incentive that was leading this difference between boys and girls. The second program was the female secondary school stipend program. In this case, what the authors of one of the studies noticed is that the program was achieving an outcome that was desirable, that is to increase female labor force participation. So it was doing that. But what wasn't predicted was that this increase of labor supply wouldn't be followed by an increase in labor demand, because it wasn't actually, the program cannot do that. So what happened in the end was that this increase of labor supply and not increase of labor demand led to a decrease the level of wages. So there was also this negative, somewhat indirect effect due to this program. The other question, I'm gonna leave to McConnell to answer. If there is anything else, I will try to answer on the Q&A chats.
Sure, McKinnon, go ahead.
Yeah, all right, okay. So yeah, it's a very good question from Ruby Khan about the reform process of the National Social Security Strategy. In Bangladesh, I mean, the social protection schemes are very fragmented. Over 130 schemes are running, from small to large schemes. So it is highly fragmented. There is a recent review of the NSS, which exactly recommended consolidation of these schemes into more simplified, as indicated in the question. So steps have been started. You know, there are some moves toward that, but it will take definitely a while to streamline the social security strategy in Bangladesh. So the next, the successor of the current national social security strategy will definitely look into these aspects of consolidation of the various schemes, and also simplifying, and also building the system, strengthening the systems of the social protection schemes in the country. So in a nutshell, this is what I can say. So it is, I mean, well recognized by the government to reform the national social security. and I think it is on the line for this, streamlining and simplifying the schemes into fewer schemes with both vertical and horizontal expansion throughout the country. So this is what I can say in response to this question. Okay.
Thank you, Megan. And while I have you on the screen, can you just answer quickly a couple of other questions that came? One is asking, how do you evaluate the Bangladesh's current social protection system on its shock responsiveness? And a related question is, how do you differentiate between the stand that UNICEF takes on universal social protection versus IMF or World Bank? I think they're related to the type of protection provided in Bangladesh.
Yeah, there is also another question, I think, on negative coping strategies by Beatrice. So I'll take all these three questions. Okay. So maybe to start with the with Beatrice's question with regard to the negative coping strategies where families can resort to in the context of lack of responsiveness of social protection schemes, like skipping meals in terms of just hunger, in response to hunger, in response to the employment shock, income shock that families, particularly those vulnerable families, face. So there is skipping meals, resorting to poor quality and nutritious food, which result into negative nutrition outcome especially for children. And importantly, I mean, we need to undertake a study, but this is, kind of a hypothesis, and that, child marriage is also increasing. That's also another negative coping mechanism that families adopt to deal with the stress, caused by COVID-19 loss of income. So child marriage is also on the rise from the various source of information that we have, but we need to have investigation into this, study into this. So these are some of the negative coping mechanisms that the families may adopt. Then moving to the other question, I think what was it? Okay. I'm just scrolling through.
Okay, Megan, it's okay. Why don't you take some time to read, and then we can come back to you.
Okay. So there is Isabella's question about evaluating the current social protection schemes shock responsiveness. Well, okay. This is, I think, $1 million question. I mean, there hasn't been any evaluation of the shock responsiveness of the current social protection scheme, the NSS. This is, one thing that we need to look into, but generally, there is not, the National Social Security Strategy or Social Protection Scheme in Bangladesh are not as such adjusting to shocks. But of course, there are disaster response, strategies that respond to shocks as they happen, but it's not like, strategically addressing, systematically addressing shocks as they come, especially considering that Bangladesh is a very disaster-prone country. I think the last question is about the approaches of the Bretton Woods institutions as well as UNICEF with regard to universal social protection by Carlos Soto. Interestingly, World Bank, who have been, very much, champions of proxy means test or poverty targeting, are now gradually considering universal social protection. In a move towards that, very recently, there is this kind of position to use affluence influence testing as opposed to proximity testing, meaning that the rich may exclude themselves, self-exclusion. So this is, kind of progress with regard to, especially, I mean, a major player in social protection in the world, World Bank being, one of the major players, including in Bangladesh. So they have very large schemes, social protection, but they all know that these schemes are suffering from high exclusion errors. So this is good news for us in development community, particularly in the UN, UNICEF, and especially ILO, who are like advocates for universal social protection. So this is a welcome development from World Bank. I think I've touched base on the questions.
Can I just, we need to go to Fabiana because there's a couple of questions for her. Then we'll come back to you if you have time. Okay.
All right.
Fabiana, Maha is asking regarding secondary school social protection scheme. Does eligibility criteria of remaining unwed and without children have a disproportionate impact on adolescent girls as compared to boys due to national child marriage and early union rates?
So this, I ended up typing the answer, but I'm going to repeat just very fast here. So this program was first only targeted girls, but then the program was expanded to cover boys as well. So the conditionalities in theory are applied to both boys and girls, but indeed in practice, they do affect girls more than boys. But it's important to highlight that this conditionality is a verbal commitment, it's a soft conditionality, meaning that the beneficiaries do not lose their benefits if they're not able to comply with them.
Okay. Okay, thank you. We will take a question at least from Maldives because we are running out of time. Krista, there's a question on Maldives from Isabella, who asks, who are the 10% Maldivian population excluded from the universal health insurance? Does it occur due to exclusion errors?
Hi, Isabella. Thank you for the question. So most probably it is the non-nationals, non-nationals meaning not Maldivian nationals. When we look at the population there right now, the overall population is about 500,000 people, a little bit more, and about 140,000 of them are migrant workers, and within them about actually 64,000, if I remember the numbers correctly. Almost half of them are undocumented migrant workers. So the chances of them being excluded from the health insurance are huge. First of all, if you don't fulfill the Maldivian nationality requirements, you are automatically not included in the program. That's my answer to Isabella.
Okay, so while you're on the screen, I would say, can you also answer, did you find any social assistance programs that were particularly effective for meeting the need of informal sector workers, either to support income or providing a social protection floor? This is from Maha.
This is regarding Maldives now.
Yes, yes, Maldives.
No, not really. There are some ad hoc, and I think they are available for, they were available for informal workers as well, that families would go to the Ministry of Gender and Social Assistance and say if they didn't have food anymore, like if there were any programs that could support them, and that there was shelter provided, food provided to these families.
Okay. All right, thank you. Then I have another question for Fabiana. Regarding the policy recommendation adapting the social protection system to the urbanization process, Could you please elaborate more on that? How this adaptation could be done, which specific actions the country could take?
The first thing important to consider there is that the risks faced by the urban population are different than the faced by the rural population. So for instance, if I'm not mistaken, income poverty is lower in urban areas, but they face higher risks related to the lack of access to housing, lack of access to healthcare services, sanitation, risks related to nutrition, and so on. So this adaptation would have to include both importing some programs that exist nowadays and cover the rural population. So a good example is that most of the programs that relate to in-kind transfers, food transfers, for instance, and food subsidies, well, most of them are focused on rural areas. So some of them could be imported to urban areas to provide a better protection to urban population as well and mitigate some of their risks. But you would also have to implement some programs, especially social insurance and labor-related policies that target specific risks that are faced by the urban population. So the response would have to have these two components per se. But thank you for the question.
Thank you. And then I think this is the last question to McKinnon, which is to elaborate on what kind of damage coping strategies are typically employed by the vulnerable families, and which of these coping strategies are especially expected during the COVID-19 crisis.
Alim, I think I covered this one already.
Sorry, you can hear me?
I can hear you. I already answered, tried to answer this question already.
Oh, okay. So there was one question I think I left. Maybe you can answer that one.
Which one is that? This coping strategy?
Yes, yes.
I already covered it, but I can come in again. I mean, the negative coping strategies that are used include, skipping meals because, I mean, to address, I mean, the income loss the poor families and the new poor have faced. Skipping meals, resorting to poor quality, nutritious food, which all have, significant impact on the child growth, child nutrition, as well as also resorting to child marriage. There is some anecdotal evidences, although I think we need to do a proper study about it. Anecdotal evidences of a rise on child marriage as a negative coping strategy during this lockdown, and of course also during this COVID-19 crisis. Again, as a negative, which can be considered as a negative coping strategy. So I already mentioned these aspects about negative coping strategy adopted by poor households as a result of non-response or insignificant response, social protection, insignificant response. Okay. Over.
Okay. Well, thank you so much. I think we are just a little bit over time. I would think that it should be. I would like to thank. Like to thank all of you for listening in patiently, and to all the presenters who made succinct presentations. We hope that we will again be online within a month or so with another possible webinar, because I think there is a need to continue this dialogue in terms of how COVID is reshaping economies and the kind of impact that social protection can actually have on resolving some of the issues, certainly in South Asia. I believe that we are on a cusp of a large change across the international financial architecture. There is a lot going on in terms of political changes and also of geopolitics in South Asia, with China increasingly taking a dominant role in shaping both economic and trade policies in South Asia. So I think that this chapter is not closed. We will perhaps be looking at some new aspects of how countries can cope with the the COVID crisis, and how can we move forward in making sure that we provide coverage to a large part of the South Asian population, which still has one of the lowest population coverages in the world on social protection. I thank you again for attending the webinar, and thank you again to the presenters, and certainly thank you to my people who have assisted me with the questions. Sorry if there was any confusion on the questions, and thank you so much, and take care and stay safe. Bye-bye.
Bye-bye. Thank you, Alim.
Thank you, Alim. Bye-bye.
Thank you. Bye.